1. Preparing for your stem cell transplant. Introduction. If you are preparing for a stem cell or bone marrow transplant from a matched, unrelated donor arranged by the South African Bone Marrow Registry or another registry, you may have many questions. This booklet will help you understand some of the complexities of the process, provide tips on how to prepare you for the transplant, and provide support and resource guides for you. This booklet should not replace your medical advice from your doctors. The transplant team knows you best, so always follow their recommendations. Bone marrow transplant, or BMT, and peripheral blood stem cell transplant, or PBSCT, both refer to similar procedures that use cells collected in different ways. These procedures are referred to as hematopoietic stem cell transplantation, or HSCT. The type of transplant also varies according to who provides the cells for the transplant. Autologous transplants use cells previously collected from the patients, whereas allogenic transplants use cells provided by a donor. Stem cell sources for allogenic transplantation. So bone marrow is collected directly from the donor's bone marrow, or peripheral blood stem cells are collected directly from the donor's bloodstream. Alternatively, an umbilical cord contains a rich supply of blood stem cells which are capable of repopulating the bone marrow. Prior to transplant, patients receive high-dosage chemotherapy and/or radiation to destroy their disease and to make room for healthy new blood stem cells. If the dosage of chemotherapy and/or radiation is high enough to completely suppress the patient's immune system, the procedure is called a myeloablative conditioning. If a patient receives less intensive dosages of chemotherapy and/or radiation, the procedure is called a reduced intensity or non-myeloablative conditioning. Doctors first began investigating bone marrow transplantations in the 1950s. They discovered that stem cells from bone marrow given intravenously could regrow in damaged bone marrow and produce healthy new blood cells. BMT is recognized as an effective treatment for certain types of malignant or cancerous and non-malignant or non-cancerous blood diseases. Let's have a look at what are stem cells. Blood stem cells are found in the peripheral blood and the bone marrow. It is called hematopoietic stem cells. Hematopoietic stem cells are the blood cell-forming adult stem cells that are found in the bone marrow. Every type of blood cell in the bone marrow starts as a stem cell. Stem cells are immature cells that are able to make other blood cells that mature and function as needed, and these can develop into the following cells. White blood cells. White blood cells are part of your immune system that fight infections caused by invaders like bacteria, viruses, and fungi. White blood cells are also involved in allergic reactions. Secondly, red blood cells. Red blood cells contain hemoglobin, which carries oxygen to all cells in the body. If your hemoglobin levels are low, it is called anemia, and symptoms include fatigue, shortness of breath, and an increased heart rate. And thirdly, the platelets. A platelet is a tiny disc-shaped piece of a large cell that helps to form blood clots, to slow or stop bleeding, and assist with helping wound healing. thrombocytopenia is when the platelet count is low and carries a risk of spontaneous bleeding, either internal or external. Platelet transfusions can temporarily improve low platelet levels. Is your child on a transplant journey? In 2020, the South African Bone Marrow Registry teamed up with 11-year-old transplant recipient Rachel Anser and her family to produce Rachel's Second Chance. This is an illustrated children's book and educational booklet on bone marrow transplants, with hope, humor, and insight, including key elements of the transplant process and advice on what to expect during a transplant journey. Rachel's Second Chance is a resource for the whole family. Rachel's story and book offer hope, humor, determination, and love. Parents and caregivers with a young child undergoing a bone marrow transplant will relate to this book, and we trust that it will provide the inspiration needed. It is a privilege and honor for the South African Bone Marrow Registry to have been asked to contribute to this beautiful story, which reflects the love and such a close-knit family and community. E-book available online for sale is $39.95 at the following websites. And all proceeds of the sale of this book goes towards patient costs and donor recruitment. Let's have a look at allogenic transplant. An allogenic transplant is where a person receives stem cells, those healthy blood-forming cells, donated by an HLA-matched donor. The donor may be a sibling, an unrelated person, or a baby's umbilical cord blood. Patients receive conditioning, which refers to high-dose chemotherapy combined either with or without radiation to destroy the cancer or diseased cells in your body. This is also known as the preparative regimen because it prepares the body to receive the donor cells. This therapy is given over several days, depending on the preparative regimen selected. This treatment also destroys your marrow, which may be making the diseased cells. Once the conditioning therapy is complete, the transplant then takes place. The healthy donated cells are then infused via intravenous infusion into your bloodstream, similar to a blood transfusion. These cells travel to the inside of your bones and begin to make healthy red blood cells, white blood cells, and platelets. Recovery may take time and complications may arise. Your transplant team will be available to support you throughout the transplant process and recovery. Unrelated donor stem cell collections are organized through the registry, and the donated stem cells are delivered to your transplant center by a trained and dedicated courier. A hospital stay of between 3 to 6 weeks is required after the infusion of the stem cells or the transplant. During this time, you will be monitored very closely for side effects. The side effects of conditioning therapy may include the following: low blood counts, fever and infection, fatigue, bleeding, nausea, vomiting, and diarrhea, perhaps mouth sores, a decreased appetite, and skin rash. But the healthcare team will manage your side effects with medications, blood transfusions, IV fluids, and interventions as appropriate. Your full blood count, or FBC, will be checked daily. After the conditioning therapy, the FBC values will drop below normal. The neutrophil count will fall close to zero and can remain low for several weeks. And during that time, a patient is at high risk of infections. That can be the time when you feel the sickest. When the white blood cells start to recover, patients often feel better. This is called engraftment. After 4 to 6 weeks, you will be discharged and sent home. Discharge from the hospital is dependent on the following points. Firstly, that your blood counts have returned to a level the doctor feels is safe. Also, that there is no fever present or no need for IV antibiotics. Thirdly, the ability to drink fluids, nausea and vomiting and diarrhea is controlled by oral medications. Fourthly, the ability to walk and function safely at your home. And 5, discharge medications are available and the medication schedule is fully understood. The patient will be required to see their transplant doctor frequently, especially in the first 100 days after the transplant. The timeline to transplant depends on various factors, including the availability of the donor. Once a donor is identified, the hospital admission lasts on average between 3 and 6 weeks, but complications may extend this time frame. So the factors affecting the length of stay includes the following. The donor source. Was it a sibling? Was it an unrelated donor or a cord blood? The intensity of the conditioning regimen. Was it myeloablative, reduced intensity, or non-myeloablative? The age and overall general health going into the transplant. The time taken to engraftment. And of course, individual response. Recovery after discharge may take several months to even a year or more, and individual cases vary a lot. Let's have a look at what is HLA matching. Human leukocyte antigens, or HLA, are proteins that are present on the surface of all cells in the body except red blood cells. Your immune system uses these markers to recognize which cells belong in your body and which don't. The HLA testing identifies the major HLA antigens that are present on the surface of your cells, and the results of this testing is used to match patients and donors for the stem cell transplant. HLA matching is much more complicated than blood typing. And to have HLA matching done, you and any potential donors will have blood drawn or buccal swabs taken inside your mouth. The blood or swabs are then tested in a laboratory to determine the HLA type. Then your HLA type is compared to that of any identified donors to see if there is a possible match. HLA types are inherited, so you're more likely to match someone from a similar ethnic background. Sometimes doctors have a difficult time finding a match because some HLA types are less common than others. But once a match is found, the donor will have medical tests to make sure they're healthy and can donate safely. An umbilical cord is also tested for safety. This is a simplified picture of very complex processes. So what are the diseases that are treatable by transplants? Leukemia and lymphoma, for example, myelogenous or lymphoblastic leukemia or Hodgkin's lymphoma. Bone marrow diseases and other diseases where the bone marrow fails to work properly, such as aplastic anemia or Fanconi's anemia. Also, inherited immune system disorders such as SCID, severe combined immunodeficiency syndrome. Also, hemoglobinopathies. Now, these are diseases with poorly functioning red blood cells and include thalassemia, and sickle cell disease, some inherited metabolic disorders, myelodysplastic syndromes and myeloproliferative disorders, multiple myeloma and other plasma cell disorders, and certain other malignancies or cancers. Let's have a look now at pre-transplant testing in more detail. Before you're admitted to the hospital for transplant, the transplant doctor will complete a medical assessment, or what we call a pre-transplant workup. There are two reasons why this is necessary. Firstly, the transplant team must be certain that your organs are functioning normally before high-dose chemotherapy is administered. And secondly, the medical aid schemes require these results to authorize payment for the transplant. Pre-transplant testing may be completed at the transplant center or through a local doctor. These tests include an echocardiogram. This is an ultrasound of your heart to show how well it pumps blood to the body. An electrocardiogram, or ECG. This measures the electrical activity of your heart. A pulmonary function test measures the lungs' ability to perform effective breathing and oxygen delivery. This test requires you to follow instructions to breathe in, hold your breath, and exhale it forcefully. Caffeine and smoking are not allowed on the day of testing, as these may affect the results. A chest X-ray. This evaluates the heart, lungs, and chest wall for any abnormalities. Then blood and urine tests. This is to evaluate the kidney and liver function. The full blood count is also done. We also measure disease status. So the infectious disease panel is a screening for a variety of previous infections. Please be aware that HIV testing is done on all SCT patients. A social work consult. A social worker will meet with you to assess your psychological, social, and emotional and practical needs. Your main caregiver should be present at this appointment. Additionally, patients may also need a bone scan, which uses a small amount of radioactive material to create images of your bones on a computer screen. This test is useful in finding the spread of cancer to your bones. Also, a bone marrow biopsy. A sample of your bone marrow is examined to confirm your disease status and/or your remission. And a computerized tomography or CT scan. This is a series of X-ray pictures taken of the body from different angles to search for abnormalities. This is often done at the same time as a PET scan to confirm the findings. A dental evaluation. It is highly recommended that you see your dentist prior to having a transplant. Any dental work should be completed before chemotherapy is given. A magnetic resonance imaging scan, or MRI. This uses very high-powered magnets to form detailed pictures of the body's soft tissues and identify areas where tumors are present. You may not be able to have an MRI if you have any metal inside your body. Also, positron emission tomography, or PET scan. In this procedure, you are injected with a small amount of radioactive sugar that cancer cells quickly consume. This causes them to light up on the scan so that the doctor can easily visualize their location in the body. You need to fast prior to the PET scan to make sure that your own body sugar is not too high. Also, tissue-specific biopsies. A small sample of tissue, for example a lymph node, is removed and examined in the laboratory. This confirms the presence of disease in a specific location. Pregnancy testing and fertility planning. If you are a female and of childbearing age, a pregnancy test will be required before admission. And for both men and women, it is important that you discuss fertility concerns and contraception with your doctor prior to your transplant. Now, not every patient is a good candidate for an allogenic stem cell transplant. There are many factors that must be considered before moving forward, and these are the response of the cancer or disorder to chemotherapy or radiation and other treatments, the organ function such as the heart, lungs, liver, and kidneys, the overall health and activity level of the patient, and also social support and the ability to follow very important instructions related to medical care. The transplant team may decide that you do not qualify for a transplant because they believe that the risks outweigh the benefits, and then other treatment options may be recommended for you. The following may be suggested: other types of treatments or chemotherapy or radiation, a clinical trial at your transplant center if one is available, or even at another hospital. Another opinion from a hospital that may have different standards than your current transplant center. So please feel free to discuss this with your SCT doctor. Now let's look at getting ready, both physically and emotionally. As you prepare for your SCT, talk to your doctor about ways you can help yourself prepare for the treatment. Your doctor may recommend activities and perhaps specific exercises to help get you physically stronger. We realize that the time prior to SCT may create feelings of anxiety as you are going through the medical evaluations. Exercise, as guided by your doctor, can be a very useful way to reduce anxiety and stress while optimizing your fitness level going into the SCT. Nutrition is very important to help you maintain your weight and strength during the transplant process. The chemotherapy you will receive during your stem cell transplant will affect your nutrition in many ways. You may find that you are not eating the way you normally do because of nausea or mouth and throat soreness, a lack of appetite, or changes in the way foods taste. You will meet with a registered dietitian to help guide you on the best food choices before, during, and after the transplant. Emotional readiness is very important as well. A blood and marrow transplant is a long, emotionally and physically challenging process for you and your loved ones. Feel free to discuss any concerns you have with your coordinator, nurse, doctor, or your social worker. Smoking cessation. All patients and visitors coming to the transplant unit must be aware that smoking or vaping is not permitted anywhere on site. Feel free to discuss your options for cessation with a transplant coordinator, clinical social worker, or your doctor. What about alcohol and/or drug addiction? Being honest with your transplant team about these issues is very important. Our goal is to get you through the stem cell transplant safely. In order to do that, we need to know if you have any alcohol or drug-related problem or concern. We will then direct you to the right professional and resources for help. The transplant team can help you meet the requirements by making appropriate referrals based on your addiction and your commitment to overcome it. This guide is continued in Book 2, Hospital Admission and Transplant.